Hello and welcome to Glamour Podcast Talk Show. Here we inspire, heal, and transform lives through conversations that matter. Today is our next episode, and I'm excited to be joined with a colleague and a good friend. His name is Musawa Toruchi Repeater Jr. Today we shall be talking about a health topic, and we shall be seeing how the doctor-patient relationship is all about. Please welcome with me Musawa Toruchi Repeater Jr.
I appreciate all the hype. Like they said, my name is Peter Toruchi Jr., a clinical officer by profession. We are talking about the patient-doctor relationship today, just like any other relationship. Maybe just like marriage, only that here, one is in a clinical court and another one is in a patient gown. And though maybe nobody there in the blind vice.
Thank you so much. So before we go deep, I want you to help me or to help the viewers who are looking at us or who are listening to us right now. Please, can you give us, just briefly talk about this doctor-patient relationship? What is it all about?
Well, the patient-doctor relationship, just like I said, like other relationships, only that this is a professional connection between the healthcare provider and the patient, may be built on trust, respect, communication, but with the aim of improving the patient's health.
Yes.
That is a brief explanation, or that is a simple definition to the patient-doctor relationship.
Yes, you talked about something very important, trust. Trust is very fundamental right now. And when we talk about people-centered care, it is very important that this kind of relationship should be stronger and also should have that kind of trust for it to be able to last. Yes, thank you so much, Musawa. Now I believe someone can be able to differentiate and understand what this doctor-patient relationship is all about. It's not like the other patient relationship where maybe we're talking about coupling between the patient and the health worker. Though we also have those aspects that come in where we have a patient falling in love with his doctor. We shall also look at that aspect under some of the barriers in front there as we go on. Then, so before we go even deeper, can people who are looking at us understand some of the components of this doctor-patient relationship?
Yes, that is a nice question. What are the components of this patient relationship? Or before even we go that far, why does it matter to talk about the patient-doctor relationship? Because when this relationship is strong, doctors make better decisions, patients follow instructions, and we have faster healing and hence improving the patient's life. And when this relationship is weak, just the doctor will be frustrated, the patient will not follow instructions, maybe because the treatment you're giving is not working like she expected or like he expected, and at the end, there's no healing, everyone is frustrated, and you find the patient on Googling symptoms and signs and convincing themselves that maybe they are having like 7 diseases at once, and which may not be the case. That is why this relationship is very, very important. We talked about the components of a patient-doctor relationship. Like any other relationship, trust is the heart of every relationship. That is my first component, or the first component of a patient-doctor relationship. Patients must actually trust that the doctor always wants the best for them. And therefore, the doctor should also trust what the patient tells them during this clerkship or during the gathering of the information about the patient and what. Only that some patients will hide away information or they intend to lie. You ask a patient, do you drink or do you take a beer? And the patient will say, yes, doctor, I do take a beer, but I take only one. But yet, the liver is shouting, Halimba, Halimba, Anwani Walaj. So that is very important.
Yes.
Another component is communication. Communication is just the only way the information can be shared. The doctors, you must make sure that you use simple language that the patient can understand. The patient is only interested in knowing what the problem is, not knowing your surgical exam or the nursing procedure. That doesn't matter to them. So you must avoid medical jargons when you are talking to your patient.
Right on that point. I've always had instances where a patient comes from the hospital, but the patient doesn't even understand the diagnosis that they have been treating, but yet the patient has been on treatment for like a week, but doesn't even understand the reason as to why it's being given.
Very, very good. And by the way,
yes, it comes down to that issue of communication.
True.
Yes.
Patients, please. Communication is not only one-sided, that the doctor is the only one to speak. No. If you don't understand anything, please ask. Never to ask questions. What do you have to fear your doctor? Ask questions. Don't just nod politely like you're understanding everything, or like you're trying to understand a lot of the complicated movie. Yet at the end, you have nothing to take home. It is very important to improve our communication.
That is true.
That is the second component. Another component is respect. The doctor must respect the patient's dignity.
Is it one-sided?
It is not. And the patient too, you have to respect the doctor's expertise and time. Sometimes you schedule an appointment with the patient, you tell them like 2 p.m., you have to be there, and the patient shows up maybe like at 4 p.m. and you ask them, Dr. Kajam, yet the very doctor passed through the same job. So through it, that shouldn't be an excuse. You should respect each other.
But again, yeah, there can be some inconveniences along the way. At least communicate that, doctor, I'll be late, so I'm likely to reach at this time. So that the doctor is in sync with whatever is going on with you.
Yeah, true. And then the first component is empathy. Sometimes these patients are not just speaking carefully. Maybe they are scared. They need some simple reassurance to get back to the track. And maybe, doctors, you shouldn't rush in any kind of situation if it's not an emergency situation. Take your time and track this patient. Feel what they are feeling. Try to be empathetic. Try to put yourself in their shoes. Sometimes it's just a mere statement, I understand what you're going through, is better than an injection.
You put yourself in a patient's shoes.
So a good doctor, you must listen, you must be honest, and you must speak with compassion when you're talking to these patients. And the fifth component is, I think, continuity of care. You must make sure that you follow up your patients as a health care provider.
Very fundamental.
Care doesn't stop just when the patient has left the room. Maybe a simple call or a quick message may make this patient feel valued at the end, and maybe you want to know how the medications you put on the patient, how they are treating him or her, whether they have new symptoms or signs, or whether they are improving or not. So care must continue up to this patient feels better.
I'll give you an experience. Actually, it's a scenario. There's one time I had a patient. It was a Somali. One time I had gone to work on her, and she told me one thing, that there's something that is missing in our healthcare, especially here in Uganda. I think it's not only here in Uganda, but all over East Africa and Africa, even other countries out there. It's that follow-up, because the patient feels cared for with that call that you make after they have left the facility. She told me there's a time when they called her, not that because maybe she had slept well, I just wanted to know how she had spent the night. She became very happy. She told me, man, what you've done for me, I'm feeling more happy. Just that mere call was able to change her mood, and she really felt cared for. So you can see how important follow-up is. That follow-up, just a follow-up call, or just saying a hi. How did you spend the night? It's very, very important.
Moving to another component, it is shared decision making. We are no longer in colonial medicine, or where we say that always the doctor is the master, or the doctor has always to say. This is the patient, it is their life, it is their body. You have to involve them in your conversations. Let them participate in their mode of treatments they would like to have. Share options, and then the patient should choose. Involve them in decision making upon their lives. Another component is misunderstandings and conflicts. Like I said, in every relationship, we expect to have misunderstandings and maybe to have conflicts along them. It can never be a clean relationship. So we must understand how to deal with these conflicts or these misunderstandings between us as healthcare providers and patients. Patients, this goes to you. If there is any mistake or if there is any misunderstanding that happens between you and your doctor, you should always know that even the person who is working here as a doctor has medical knowledge, but at the end is liable to errors. He is a human, or she's human. So don't capitalize on their mistakes. And then all of a sudden you hear, you there, maybe this doctor did this, and then you forget that before that they did good to you.
Yes. Actually, first appreciate the good things they have done. It's always good, actually. Always be like that in life. Not only here in the patient relationship kind of care. In life, first appreciate the good things the doctor has done. Then now you can try to bring in the other aspect of the mistake. Then you come to a round table.
So as my last component is professional boundaries. Professional boundaries. Like we said, empathy is important. But boundaries and relationship, professionalism, you and your doctor or the patient and the doctor, you should have limits. Don't involve yourself in a romantic relationship with your patient. Respect your patient and protect each other. Have weird strong. Don't cross your boundaries as a healthcare provider. Those are the components that we can try to talk about or single out under the patient-doctor relationship.
I don't know if you can go ahead and elaborate on some of the barriers. So you already shared the barriers.
There are barriers,
yes,
which can really hinder
this relationship from going on and growing. Because at the end of it all, we want to have a strong relationship that is built on trust. So those are some of the things that we want to understand, and there are some of those barriers that can hinder this kind of relationship from progressing and building and helping the patient, and also the doctor himself benefiting from this kind of relationship.
To doctors, what can you do, or what are the barriers that are more centered to the doctors or to the healthcare providers that can hinder this relationship? If you're not communicating clearly, or if your communication is poor, as a doctor, using the same place and that, you don't keep confidentiality. Yes. If you're a doctor and you're not listening to what your patient is telling you, if you drift up and you judge your patient just because if maybe you have had rumors about them or you've had anything bad about them, and then you start judging them from nowhere, that can really hinder what can be a barrier in this relationship. And then to the patients, if you're not honest enough to tell your doctor the truth, you're going to mislead the doctor during this process of arriving to the diagnosis. Because if I ask you some questions, it is not that I'm onto you, you like spying on you or like letting out your secrets to the community. I want to know so that I can help you as a patient. Some patients are not honest. They will tell you, doctor, me, I have no secrets. But when you ask them about their sexual relationship, some of them will say just like broken radios that you ask yourself, now what's wrong with this one? And then another thing is fear and stigma. You hide information because you think that the doctor is going to what? Is going to judge you, is going to expose. And that is not the what? That's not the case. Just imagine like in this scenario, this man comes to your clinic or to your facility, vomiting, with abdominal pain, and maybe they fear that the doctor is going to judge them. They hide away information that they ate a roadside chicken at 2 a.m. Just imagine if they had openly told the doctor that they actually ate that roadside chicken. The doctor would have solved this mystery faster than a detective. So you see, honesty saves suffering, saves time and money. So please, patients, you must try your best to make sure that you are honest with what you speak. Let it be the truth, and only the truth. Although I'm sounding like a lawyer, but that is not the case. Then, as I'm concluding, patients and doctors out there or any healthcare provider, this relationship works better when we are in an understanding, both sides, the patient and the healthcare provider. Just like two hands, they work better when they are together. You must follow the doctor's instructions, take your medications fully as the doctor said. Don't just take medication for 2 days, the doctor has prescribed 5 days, but just because for you feeling better on the second day, and you decide to leave the other treatment. That doesn't make sense. It is just like you going to the bathroom to bathe and you wash only one outfit. You're helping yourself out.
And that is the reason why we have a lot of antimicrobial resistance.
You're very right, you're very right. Now, to the doctors, you must be honest too, and you must make sure that you're doing the right decisions and be confidential with the patient's information. Let this relationship be a healthy relationship, and at the end, we shall all achieve the desired decisions. And then to the audience watching us and listening to us at this very time, in the comment section, these are the questions that I want you to ask yourself. And maybe if you also want some replies, we shall be able to reply to you. As a patient, have you ever left the clinical room feeling misunderstood? Maybe like the explanations you were given, or what the doctor told you, you didn't pick anything or you didn't pick it, and you leave the hospital without knowing what is wrong with your health.
Share that moment where you felt like you were not understood the way you wanted to.
Another one, do you feel comfortable asking your doctor's questions? Or you're always in fear because he's the doctor? The third one is to the patients. What do you think that the doctors or the healthcare providers, anyone there, can do to strengthen and improve this relationship? And then to also, for medics, what do you think that we can do to also improve the patient-doctor relationship? With those few words, wish you well and may God protect you.
Thank you so much, Mr. Turuchi and Peter Jr. It was really informative. very exciting. I hope the viewers, the listeners have been able to learn something about the patient-doctor relationship. It's very important. The same way you have your businesses out there, maybe you're dealing in merchandise, different merchandise, you're dealing in grocery. We have that what we call a customer-seller relationship. Also in medical, we have what we call the doctor-patient relationship. So it's very, very important to understand how to connect these two. Okay? Because if this relationship is not built well, the other party may not benefit, or all the two parties will not be able to benefit from each other. So it's very important to make sure that we have a common ground where we can be able to help each other as a community, as people who are living together. Yes. Thank you so much. So that has been our episode about doctor-patient relationship. I hope you've been able to learn. Please make sure that you comment, you share, you like, you follow. And also subscribe on our YouTube channel, that is Mlamu Podcast Talk Show. Yes, and make sure to follow up on our upcoming episodes. I've been your host, David Nyamurangwa, and my guest, Turuhichi Peter Jr. Hope to see you next time.